Hey everyone, this is Dr. Francisco Maia with the Canine PT, and we specialize in helping senior dogs improve their independence with the daily routine so that they can live their golden years without the need of pain medications. And today we're going to talk about arthritis. So today is episode 2 of our series of Senior Dog Saturdays. Okay, we're going to talk about arthritis, a normal aging process. Why this is the first thing I want to talk about it after listening to episode 1, where I mostly introduced myself and talked about what the goal is with this segment. Okay, and the reason behind I want to talk about arthritis is because there's a lot of misconceptions behind it, and you can figure it out by the title of this episode, a normal aging process. Okay, so here's the thing that happens commonly with our senior dogs is that they start slowing down. They have some sort of issues where they're having difficulty going on walks, jumping up on the furniture, and just getting around in general, getting up from the floor. And then you as the pet owner go to the veterinary clinic and you express those concerns. And then of course the first thing they're going to do is to do an x-ray to look at the joint, see how everything looks. And then they found arthritis in the joint. Okay, so that's why I want to talk about it, because pretty much arthritis is going to be found on any aging mammal, like humans, dogs, and so forth. It's a normal process. So just to dial back a little bit, so arthritis, what does the word itself mean? So it comes from Latin, and arthro meaning joint, and itis means inflammation. So it's inflammation of the joint. Now, it doesn't mean necessarily that your joint is inflamed. So what happens is research in the human side shows that everyone on their late 20s, early 30s already starts showing signs of arthritis in the joints, and then it just progresses as we age. It's a normal aging process that we all go through, but what happens is it's kind of like a dormant kind of thing, okay? And then something happens, either a little bit of a traumatic event, slipping downstairs, or with us, you know, going for a run or exercising or something like that. Something aggravates the joints, and then that's what triggers that inflammation. So we had the degenerative disease of the joint. We already have that process going on, but we didn't have the inflammation. We didn't have our pain fibers firing enough because something didn't feel right. And that's kind of like what arthritis is. So it's never going to happen where there's a traumatic event, either with you or your dog, and they do an x-ray and then it's arthritis, because arthritis simply doesn't happen overnight. It doesn't show up just like that. It takes a long time to progress, and then we just have an inflammation. So what we call like an acute or chronic or whatever may be. You know, acute is when, as you can imagine, something happened recently, the last 48 to 72 hours, and things are really inflamed. Chronic is when we're just dealing with that cycle of, like, you get better and then you get worse, you get better, you get worse. So you have that chronic issue going around, and there are different ways to manage the acute, different ways to manage the chronic, and we're going to talk about going forward in future episodes. But today I just want you to understand a little bit why I wanted to talk about arthritis. Okay, so it's a normal aging process that it happens with all of us. It happens with our senior dogs. Now, what defines a senior dog too? It can vary. So usually, you know, veterinarians will say around the age of 7 or so, it's about the time, but that will vary with breed, that will vary with sizes and everything. Some larger breeds, you can consider it like a senior dog around the age of 5 or 6. Some smaller breeds, it's more like around the age of 10 or so, you know, because as we all know, unfortunately, the larger breeds have a shorter lifespan than the smaller breeds, because they do develop a lot of these joint issues that we're going to be talking about, okay? But the one takeaway point that I want you to get from today's live is that arthritis, it's a normal aging process, and there's a lot of things that we can do to manage. There's exercises, there's good nutrition, there's supplements, there's medication when needed, there's different treatment modalities, laser, acupuncture, manual therapy, and so forth. All of this, depending on each case, can kind of like work all together, or some things might work better than the others. And we're going to be talking about all those different things that are out there for you. We're going to be talking about things you can modify at home to make it easier for your pet to get around, so that way you're avoiding any of those accidents, slipping, tumbling the stairs or something like that could aggravate the arthritis and everything. But today, just understand, arthritis, it's a normal aging process, okay? We all go through it, and it's not a diagnosis that it should scare you. If you go to your veterinarian and your veterinarian x-rays, usually the dogs can get arthritis on the shoulders and elbows too, fairly common, but usually it's going to be more like hips, knees, and back, And so if they x-ray and they're like, oh, your dog has arthritis, one, don't be alarmed by it. It's a normal process. There are definitely a lot of things that can be done to help your pet. And two, don't think that that all you can do is just a pain medication. The pain medication can help in the short term, but what's going to help in the long run is going to be a combination of a variety of different things that we're going to be talking about, okay? So thank you all for listening. If you thought this message was helpful, please go ahead and share, write any comments. I'm always replying. You can send a personal message if you prefer to keep your message personal, like a couple of you did last time. And also look out for next Saturday as well. It's going to dive more a little bit into the things that you can do to help your pup if they have arthritis, okay? Thank you so much, everyone, and have a good Saturday.